In this pediatric well visit encounter, we'll be documenting the provider's perspective of a 12-month well visit. Encounter Pro has queued up many of the elements of the exam for both staff and provider through the Pediatric EMR workflow system. Generally, a provider will start at a preview screen. This preview screen allows us to see elements of today's visit, including the chief complaint, height, weight, also any parents' names or sibling information. Moving into the patient's chart, we'll have the opportunity to document elements of the exam like the review of systems, the PFSH, the physical, and many other elements. The review of systems can be documented simply with a click, documenting all normals. If there are any abnormals in this exam, we can document those by drilling down into each specific system. The past family social medical history is queued up for review, and in our case here we can see that this patient's birth history includes jaundice requiring phototherapy for the first 3 days of life, including mother's history of asthma and paternal grandfather's hypertension. We'll also have the opportunity to document growth and development. In this case, we'll take a look at our growth charts, in which we can print these for either other clinicians or the parents, and we can document those based on weight versus age, length versus age, length versus weight, or head circumference versus age. We have an opportunity to document the developmental milestones, and in this case we'll document our 12-month developmental milestones and document that this patient meets all milestones. Moving on to the vaccine review, Encounter Pro is going to suggest for you the vaccines that need to be given for today's visits. Encounter Pro also has a feature that will show you projected shots. So for example, in the case of DTaP here, we can see the 3 shots given and the 2 projected dates. These are driven by CDC guidelines, and they also take into consideration catch-up schedules. Moving on to the physical, we can document our physical exam again with a simple single touch, populating all normals. When we diagnose a patient, we'll have the opportunity to select our treatment plan, in addition to having the V code or the ICD-9 codes automatically associated with, in this case, our well child 12-month exam. Today we're going to give a couple of vaccines. Vaccines include varicella, Prevnar, and Hep A. We also want to queue up a service bar or a task for our front desk to schedule a follow-up in 3 months. At the end of the encounter, once you've ordered your treatment plan, you'll have the opportunity to review your billing. Your billing will be queued up with appropriate ICD-9 and CPT codes, and this of course will be sent over to your practice management system. The tasks that we've queued up, including the vaccines for the clinical staff, are shown here in the office view. This office view is your primary form of communication for ordering tasks for your clinical staff to perform. In this case here, we'll administer one of these vaccines like Prevnar. Prevnar comes up with maker, lot number. We are going to give the literature date. And where we give this shot. At the end of the encounter, an encounter note can be processed and reviewed and sent to other clinicians for review. A hard copy of this report will be provided to you.